At the heart of the pediatric ward of Wajir's referral hospital, doctors are battling to save the life of a young boy. He is on oxygen support, his body weakened by Kala-azar, a tropical parasitic disease that has devastated families in this arid region. One of the biggest threats to his recovery is not the disease itself, but a severe drop in his platelet count, a complication that calls for urgent blood transfusion, but there is barely enough blood to go around.
As a community, we don't have a culture of donating blood, so we normally rely on replacement donors from the relatives. But the challenge here, most of the patients are actually coming from interior in the sub-counties, and these patients are normally children under 5 are accompanied by their mothers. Some of them also, the mothers themselves, their HB is actually low, so they are not in a position to replace blood, and most of the people don't have relatives around, so that is a very big challenge for us.
And the disease, most of the patients are coming when they are very late to the hospital, owing to the fact that our health-seeking behavior is very, very, very poor. So when a child has malnutrition, when a child has anemia and gets Kala-azar, the situation worsens for that child or for that patient.
Wajir is among 11 counties endemic to Kala-azar. While the region has grappled with the disease for years, the current upsurge triggered around December has reached alarming levels. As of today, the county has recorded 853 cases, with over 100 patients currently on treatment across 4 designated sites.
Actually, Wajir County is among the 11 endemic county of Kala-azar. Currently, we have 103 patients on treatment across the 4 treatment sites. So here in Wajir County Referral, we have 44 patients admitted. In Griftu, we have 51. In Eldas Sub-County Hospital, we have 15. Butte, we have 2. So in total, we have 103 patients.
Kala-azar is a complex disease causing anemia, malnutrition, bleeding, and in severe cases, death. The case fatality rate in Wajir currently stands at 3.5%.
Our case fatality rate stands at 3.5%.
The most critically ill are 4 patients, and the biggest complication that the patients have is thrombocytopenia, which means low platelets, and this is as a result of Kala-azar.
Well, the numbers of new admissions has reduced compared to last month, where over 124 patients were being treated at the referral hospital alone. The need for blood remains critical. The county's blood bank has run dry.
One of the complications is bleeding. Patients are consuming a lot of blood. A lot of blood is required. In a day, we could use 30 units of blood. Here in our county, we normally depend on replacement donor. A patient donates blood, and then a relative must, or a caretaker must replace that blood. Most of these patients who are coming, who are now admitted here in our hospital, they are people from low socioeconomic status, a mother who is breastfeeding. For example, you see a mother who has 2 children, both infected with Kala-azar. They don't have relative with them. So now replacing that blood is a very big challenge. Around February and March, the number were increasing. At one point, we had 121 patients admitted here in our main county referral hospital. So today we are reporting a case of 44 patients admitted. At least the cases are reducing. We are proud to say that.
In response, the county has launched a series of blood donation drives. At the front lines, Wajir's First Lady, who recently donated blood herself, sending a powerful message to others to take part in it.
Currently, because we don't have the donors, our blood bank is actually very minimal. Apart from the Kala-azar patients, we also have maternity cases. This being the major referral hospitals, we get a lot of referrals from the sub-counties. And most of them come mothers who are bleeding with postpartum hemorrhage, who require also blood. To the people of Wajir County, there's nothing more selfless than saving another human's life. So my plea is, please come in numbers. Apart from the blood drives we are doing, our satellite blood bank is open every day from 6 a.m. to 6:30 p.m. Monday to Saturday.
But it is not all grim. In the face of adversity, Wajir's ambulatory services have emerged as a vital lifeline. This emergency unit are bridging the vast distances between rural areas and treatment centers, saving countless lives through timely referrals.
As part of intervention, we have put our system in place very well, especially in the ambulatory services. This Kala-azar outbreak, we've been responding very well. In case there's a child or a patient that requires a referral, maybe brought with a Kala-azar to a certain health facilities, we have been responding very well.
The ambulance services are working well. It is well coordinated. It is under, there's a emergency referral coordinator who's doing a very good job coordinating all the ambulatory services in the county.
The county's wider response has been commendable, procuring essential medicine and test kits from the Netherlands.
In terms of treatment, these Kala-azar drugs, first of all, are very expensive. They are not found locally. You have to import them from abroad. We've been able to get support from World Health Organization, national government, and also the county has procured. Actually, the test kits and the drugs are not found locally. You have to import everything. So the county actually bought from Netherlands. We were able to buy test kits, the rapid diagnostic test kits, RDTs, the direct agglutination tests, that we also able to buy from Netherlands. We also bought drugs.
Fumigating outbreak hotspots and deploying community health promoters to increase awareness and encourage early treatment. Despite acquiring an apheresis machine from the national government to improve blood product processing, the lack of donors remain a stumbling block. For children, like the one clinging to life in Wajir's referral, every drop of blood could mean the difference between life and death. Shimin Abdikadir, Kala-azar Media, Wajir County.